So today we have Dr. Bharat Sharma. He is practicing in Jaipur. So we'll be taking the topic as kidney stone management as of now. So, very welcome.
Hi.
Why would you think the number of cases for kidney stone are on high rise these days?
See, there is not one factor. There are multiple factors which are responsible for kidney stones. The major factor is that India being a tropical country, we are perspiring, we are sweating more, and because of our commitment, work-related commitments, and people, especially in the rural areas, they are sweating more, they are perspiring more. So there is lack of water intake and more perspiration, which creates in the body a situation where demineralization occurs, and because of that, stone formation occurs.
Well, what has been the most challenging case of kidney stone when we talk about you that you have dealt with, and how did you remove the patient's stone? Any instance?
Recently I have operated a patient, multiple patients I have operated, and the biggest problem as a urologist which I feel occurs to my patients is the patients are not having any symptoms. They have stones for long durations, maybe since 5 6 years or 10 years, who knows, because they are asymptomatic, and initially patients ignore their symptoms. If they are ignoring their symptoms, say for 1 or 2 months, their kidney may become non-functional, and later they are presenting with completely gone kidney, and the kidney's function is not there. Kidney is just like a balloon filled with multiple stones. So yeah, in that case scenario, we subject the patient to a particular scan, and in that scan we will come to know whether the kidney is functioning or not, and then whatever the number of stone, if the kidney is functioning, then we can remove the stones. If not, we can do a nephrectomy, and we have to make the patient stay on just one kidney. So that is the most worst scenario, in which the patient do not have pain and they do not realize that they do have stones. So I will suggest that in case if you have a bare minimum of pain in any of the back regions, you better get an ultrasound. This ultrasound will help you protect your kidney. If not, you will be losing one of your kidneys, which can be drastic in your lifetime. You may have a lifespan of 30 40 years in front of you.
Well, in your experience, when we talk about kidney stone, what precautions can effectively prevent these sort of stones? And if, for example, if I had one and I want to avoid the recurrent stones, what should be the prevention?
Very good question. So the recurrent stone former, the rate is approximately 50 to 55% in 10 years. So suppose if you have developed one single stone, so there are chances, if I have removed your stone, but still there are chances that in 50 to 55% of the patients, it means 2:1 chance that you will again develop a stone, and that might be a bigger stone or multiple stones. So you have a tendency to form stones. So in order to protect those stones, what we have, some drugs, we have certain drugs. The best possible way is we can do a metabolic evaluation. We can test your blood and urine. We will know that what minerals are lacking in your body or in your urine, which are precipitating stone formation. The second most important is drink adequate water. You should have at least 2.5 to 3 liters of water per day, or in layman terms, to the layman, I can suggest that your urine should be of the color of your water. So it should be transparent urine. It should not be very dark yellow color. It means that your urine is, you are not adequately hydrated. So try to drink as much as water. It will prevent stones. And considering the global warming and the country which we are living in, there are very high chances that these stones will come to a rise even in the next coming years. So it's better to take care and take precaution.
Well, any misconceptions or the myths you would like to break here?
Yeah, there are a lot of I have been I'm dealing with a lot of rural patients. So there is a saying that the homeopathic medications, there are some quacks, and those people are giving prescriptions to the patients, saying that in 1 month I will remove 100% of your stones. And on the contrary, I have operated two of those homeopathic doctors who themselves are not able to treat their stones. So I would suggest layman to, okay, if the stone is not obstructed, you can just take a chance and get your homeopathy or whatever treatment done. But if you have an obstructed stone which is causing harm to your kidney, please do not delay. Your kidney, there are two kidneys, but that doesn't mean you love only one kidney. So you have to take care of both the kidneys. Right?
Thank you so much, sir. It was very amazing and pleasant to have a talk with you.
Okay.